Hello. Welcome to another Physician Spotlight. My name is Dr. Carolyn Newberry, and I'm going to be serving as your host. I'm excited to be sitting down today with Dr. Robin Mendelsohn, who is the Clinical Director of the Gastroenterology, Hepatology and Nutrition Services, as well as an Associate Professor of Clinical Medicine at Memorial Sloan Kettering. Dr. Mendelsohn, very nice to see you today.
Hi, thank you so much for having me.
No problem. I always ask people that I'm interviewing, what sort of brought you into nutrition, and tell us a little bit about that journey.
I think most of us that got into nutrition have an interesting journey. I was always interested in nutrition, took classes in college, was sort of disappointed that it wasn't more of a major focus during medical school and residency. And then when I did my fellowship at Memorial Sloan Kettering, we actually had 6 months of dedicated nutrition during our GI fellowship. And during that time, I really solidified my interest in nutrition, and really saw what a critical role it plays in all of medicine, but especially as gastroenterologists, and became really interested in how to integrate nutrition into my practice.
Yeah, that's great to hear. And as a fellow gastroenterologist who also has a nutrition interest, I'm excited to, speak with other people that understand how important, nutrition is to the digestive tract and its health. Um,
Absolutely.
and definitely tell us a little bit about the nutrition service that you run at Sloan Kettering.
Yeah, so we have a dedicated nutrition fellowship. It's a 1 year clinical nutrition fellowship, which focuses mostly on enteral and parenteral nutrition. As a cancer hospital, we do a lot of supplemental nutrition. We also have a lot of patients with nutritional disorders, malabsorption, short gut, and we get these consults as gastroenterologists, and a lot of gastroenterologists put in feeding tubes and then send people on their way, or they order TPN and then they get a generalized TPN formula. And our service really individualizes nutrition for all of these patients. Every patient gets a specialized either enteral or parenteral nutrition order, which is changed based on clinical status. And as our clinical nutrition fellow goes throughout the year, they learn how to take care of these patients. Most of these fellows go on to do gastroenterology, and I think that's because the majority of our service are gastroenterologists, though we do have one nephrologist. But we've had people go on to every aspect of medicine, renal, endocrinology, even surgery, because as nutrition is fundamental to almost every specialty, and every general service as well. And so we provide that foundation, and our fellows go on to utilize nutrition if they become gastroenterologists in their practice, or whatever they do. And we've had people go on to start nutrition programs in other places, and they really have a unique opportunity to use these services in places that may not have them.
Yeah, I mean, I think it's such a unique opportunity for GI fellows to have that much exposure to nutrition, because so many programs, including the one that I trained at, we just really don't get that during our training. So it's
Yeah, absolutely. And we have fellows and residents and med students from all over come and spend a week, 2 weeks, sometimes a month, sometimes even a few months with us, depending on their interest, to really see what we do and take that back with them.
Yeah, and I mean, it sounds like you've been a mentor to so many trainees. And when they come to you and say, I'm interested in a career in nutrition, what advice do you give them?
So first of all, I'm excited. And I tell them that it's always important to find mentors, and um, it's, I think mentorship is important and difficult, and sometimes mentorship is forced on you, and you're just assigned somebody that may not meet your needs. And I think that it's interesting because I found, roles of mentors in different people. And there's some people, like Dr. Moshe Shaikh, who is also an Aspen member, and is the head of our nutrition department. He provided me with such guidance in nutrition, and then you met with other people who would give you maybe more of a research focus or something like that. And so I encourage, these, fellows or residents to really seek out a mentor in nutrition, which is not always that easy, who can sort of help you guide you through the process of how to integrate this into your practice, or if it's your main practice, how to do that. Sometimes because our service is mostly enteral and parental nutrition, and obviously that's one side of malnutrition, and then there's obesity, which is the other side. I encourage people, if they're interested, to go out and do another fellowship or rotation to really get the whole breadth of nutrition. And I encourage them, if they want to do research, to do something that they're interested in. Though I do always caution them that nutrition research is very very difficult to do, as you know. And I just encourage them to stick with it and to try to navigate the system using the resources that we have.
I mean, I think that's great advice. And, it sounds like you've had a lot of success with mentoring people to actually go into the nutrition space, which again is very exciting. In terms of how the nutrition landscapes has changed since you started practicing, you've been doing this for a few years now. What are the biggest things you've seen?
So what's great about nutrition is that so many of the fundamentals are what we learned, even in elementary school. And so that always makes me excited that there are things that I learned in elementary school and high school that I'm still using on a daily basis. But I think that as the most interesting part, I think, to me as working as a cancer center is, when I first started as a fellow, we didn't really talk about obesity management that much because our cancer patients, they were cancer patients. We had to get them through treatment, even if they were obese. And now, as the climate of cancer has changed, and people are living longer with cancer, and obesity, as you know, is such a major risk factor for so many cancers. I found that our focus is changing, and trying to focus on treating obesity in these patients, who will hopefully survive their cancer and live long term and not have recurrence or another cancer.
Yeah, I mean, that's really interesting to hear because you're right. You always think of the cachectic cancer patient who is incredibly malnourished and needs, nutrition support. But, so many of them, you probably are dealing a lot with like sarcopenic obesity where the patients are
Right.
malnourished, but also obese. And that's really challenging arena to be in.
It is
Um,
challenging.
yeah. In addition to, everything that you just discussed, is there any direction or things that you're interested in seeing where nutrition goes in the future?
Yeah. So, I think, the other hat that I have in the hospital is that I'm the co-director of our young onset, our center, sorry, for young onset colorectal cancer. And as you know, as a gastroenterologist, we've done a great job at decreasing incidence and mortality of colorectal cancer in those 50 and over in our screening group, but we've seen this very scary increase in those under 50 and trying to figure out why. And so we opened the center now 2 years ago in March of 2018 with the clinical goal to really provide coordinated care to these patients. And interestingly, when you would talk to these patients, they would say, "You guys took a great, you guys took great care of my cancer, but no one really took care of me." And one of the main echoing voices was that they wanted to hear more about nutrition. That everyone was giving their chemotherapy, radiation, getting them ready for surgery, but they wanted control of something that they could really do. And so one of all of these patients are offered different services such as integrative medicine and fertility, but one thing that we've made sure is that everyone's offered a nutrition consult so that they can speak to a dietitian about diet and changes that could get them through treatment, but also help them through survivorship. And then the other piece is really why is this happening, and that's a big question. And the tumors seem to be similar, so the question is it something environmental or in the diet? And so it's something very difficult to look into, but something that I'm very interested in to see, is it changes in the diet, has changes in the diet causes changes in the microbiome, which is obviously a very hot topic now. And this is something that I'm very interested in, and I've tried to really intertwine GI and nutrition, to really try to not only help these patients clinically, but also with this research interest to really try to figure out what's going on.
Yeah, I mean, I completely agree. And I hope that you're able to find the answers to some of those questions because I want to read those papers. So,
We're
you know,
trying.
so I wanted to thank you to take the time to sit and speak with us. And I'm sure the Aspen community really enjoyed hearing your perspectives. And I don't know if there's anything else you wanted to add before we end.
No, I just, I want to also thank Aspen for, the resources that they provide. I think that because we all come from different backgrounds, it's sometimes difficult to find information, resources, not only for ourselves, but also for our patients. And Aspen does a great job at providing these resources for me and my patients. And I just want to thank them for all that they do.
Great. Thank you so much. That's a very nice parting word. So this was Dr. Robin Mendelsohn during today's Physician Spotlight, and we'll be back next month. Thank you. Bye.